Today we're going to speak about DIEP flaps. A DIEP flap is when a patient wants or desires using their own tissue to rebuild their breast. In these circumstances, I'll employ microvascular techniques. In the video above me, you're watching an artery and then ultimately a vein and a nerve get reconnected. The initial connection takes place under the operating microscope. There are these green clamps that are used that are holding the vessels in place. Those clamps are called microvascular clamps. The artery on the right of the video is actually from the belly tissue. The artery on the left of the video is from the chest. They're being connected with very fine suture. It's called 8-0 or 9-0 nylon. These arteries are roughly 1 to 1.5 millimeters wide, which means they're not very easy to see without the operating microscope. So here at this point, you'll see that I've connected the artery, and once I've completed the artery connection, I'm now next going to move on to the venous connection. When it comes time for the venous connection, at this point we use what's called a venous coupler. A venous coupler, if you imagine almost two prongs that are open with a lumen, so there's an opening where the vessel can be pulled through. The vessel is then set on these prongs, both from the flap side, the tissue side, and from the chest side where the blood supply is going to outflow. And those two prongs are ultimately going to close and connect and reconnect the vessel. That venous coupler is what we use to stabilize the connection, to recreate the flow of the blood supply from the tissue, right? So arteries supply blood into the tissue and veins supply blood away from the tissue. So as you see the completion, you'll see the end here. Once the veins have been connected or adapted, they're then closed. Once we've confirmed that the arterial and venous blood supply are working properly, I will now move on to the nerve connection. In this procedure, we're performing what's called resensation. A nerve has been prepared from the belly, and a nerve in the chest has been prepared. They are connected with both an adapter of form and also what's called nerve tape. Nerve tape is used to hold the nerve graft in place, as well as the current nerve that we're connecting to the graft that will ultimately be connected to our tissue.